The DHS announced 2,400 new cases today and 29 new deaths. That's below the average we've seen over the past week, which is at 2,700 cases. Right now, a quarter of all patients in Arizona hospitals have COVID, and about a third of the ICU patients have it. On the vaccination front, nearly 51% of Arizonans are now fully vaccinated. That's about 3.6 million people, with more than 1 million with at least one dose.
In tonight's Verify, more than 179 million people are fully vaccinated in the United States. That is according to the CDC.
And Arizonans have received more than 8 million shots. Still, millions remain unwilling to get the vaccine, and they also raise concerns over unverified, false, and misleading rumors about the safety of the vaccine.
Team 12's Michael Doudna is looking at the numbers and verifying common claims about the shot for us tonight.
Yeah, you may have seen posts flying around that claims that the CDC's own VAERS data shows the vaccine is killing thousands. So we're verifying, does CDC VAERS data show the vaccine killing thousands?
Our sources are the VAERS data, Debbie McCune-Davis from Arizona Partnership of Immunization, and data from the Pfizer studies. So first off, what is VAERS?
VAERS stands for the Vaccine Adverse Events Reporting System. FDA requires healthcare providers to report any death after COVID-19 vaccination to VAERS, even if it's unclear whether the vaccine was the cause.
Right now, if you search VAERS data, you will find 6,577 deaths in the U.S. But not all of those are vaccine-related. Like this case, where a 72-year-old Arizona woman died because of non-Hodgkin's lymphoma. Her death was still included because she died 3 months after getting the vaccine.
The raw numbers don't mean anything until it's investigated.
Basically, VAERS data is a starting point. From there, health officials identify trends and investigate warning signs. This process led to the pause of the Johnson & Johnson shot after just 6 women experienced blood clots.
Where they go in depth into what the information is that's provided and determine whether there is in fact a cause and effect.
In fact, the CDC warns against using VAERS data to draw any conclusions, saying it may, quote, contain information that is incomplete, inaccurate, coincidental, or unverifiable. But that's still what some people are doing online.
They're using what is in fact a very complicated system. And they're taking the numbers and they're oversimplifying them.
A 6-month study from Pfizer showed out of 44,000 people, not one died from the vaccine. So we can verify the claim that CDC data shows thousands of people dying from vaccines is false. Have something you want us to verify? Call, email, or text us.